Okay, so hello everyone and welcome. My name is Chelsea Grover. I'm the Marketing Communications Coordinator for Attentive. Thanks for joining us today. It should be a really great webinar. Before we start, I just want to let you know that this webinar is going to be recorded and that we'll actually be sending out emails next week with links to the recording as well as to a PDF of the slides. Okay, so moving on to today's webinar, The Future of Healthcare Delivery Telemedicine. A little bit about us. We've been in business since 2003, but we've been NextGen users since 1997, EPM version 2.3. We specialize specifically in NextGen healthcare. Basically, our goal in life is to make delighted clients by helping them get the absolute most out of their software investment. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. So to sum it all up, we do everything NextGen. And we also have two add-on productivity solutions for NextGen, ChartGuard and Refund Manager. I'm also excited to announce that our next webinar is going to be on October 26th, and that's going to be on the macro final rule. So that should be great. We hope to see you there. I'm also super excited to announce that today's presentations are going to be presenting another webinar on telemedicine at MGMA on Tuesday, November 1st at 10:30. So if you're attending MGMA, stop by to see them. They're total rock stars, and I know they're going to do a great job on the presentation. So just to go over the process for today, we're going to take all the questions at the end, but if you have any, please type them in the questions area of the webinar control panel whenever they occur to you, and we'll answer them at the end. And again, we will send out an email with a link to the recording and slides next week. So without further delay, our presenters for today are Lindsay Lanning, Healthcare Compliance Consultant at Attentive, and Cindy Kincaid, VP of Consulting Services. So Lindsay, I'm going to go ahead and hand it off to you. Please feel free to get started when you're ready.
All right, great. Thank you, Chelsea. Well, hi, everyone. And again, thank you for joining us today for our webinar, The Future of Healthcare Delivery, Telemedicine. With an ever-evolving patient-clinician relationship in the current healthcare environment, it's important we all take a step back and look at new opportunities to provide clinical support. The future of healthcare delivery truly is changing, and telemedicine will be at the forefront of this movement. So this presentation will introduce the fundamentals of telemedicine, focusing on the different modalities and delivery mechanisms available, and we'll delve deeper into the challenges and benefits associated with overcoming geographical barriers using this virtual platform. We will also look at the use of telemedicine with tools such as wearable devices like the Apple Watch and mobile health applications that make it possible to transmit patient data to a physician and connect with patients in ways that were previously impossible. So specifically in today's webinar, we will cover an industry outlook, telemedicine basics, the benefits and challenges to telemedicine, telemedicine today, telemedicine tomorrow, and then the keys to the successful integration of telehealth in your own practice. Our goals here today really are to summarize the fundamentals of telemedicine, so how it improves patient engagement and increases access and quality of care, clarify current and potential federal and insurance regulations pertaining to telemedicine, and then identify strategies on how to integrate telemedicine into your own practice by gaining physician buy-in. So let's start by looking at some common questions we often get from our own provider partners who are just learning about telehealth. Many ask, what are the benefits and challenges to telemedicine? Can physicians practice telemedicine across state lines? Does Medicare or Medicaid pay for telemedicine services? What is mHealth? And what is the future of telemedicine and who is using it now? Now, as we go through this presentation, we will provide you with an answer to each one of these questions. But first, let's look at who and what are driving telehealth adoption and fueling the transition to digital delivery of care. So again, driven forward by the rapidly evolving and relentless force of digital technology, telehealth is poised to change healthcare delivery as we know it. And the best way I can compare how transformational this new form of healthcare delivery is to compare it to how Uber revolutionized the transportation industry. It's changing the traditional doctor's visit into something more convenient and less costly. But the healthcare industry itself is also changing from volume to value-based care supported by quality outcomes. And telehealth contributes to this transition and is supported by a few key industry initiatives. The first being the triple aim, which we're all aware of has three main goals. And that's to improve the quality of care, improve the health of populations, all the while reducing costs. And telehealth has the potential to contribute to each one of these goals in a big way. For example, each component of the triple aim is met by telehealth when it decreases costly hospital visits, when it provides better access for patients to care, or when it allows providers to more closely monitor chronic conditions. Next, something we've been hearing a lot about lately, MACRA. MACRA was just finalized a few weeks ago and is set to take effect on January 1st of next year. Now, many people are aware that it will change how providers get paid and how they report on quality measures, but what a lot of people don't realize is how MACRA is supporting the uptake of telehealth. Telehealth and remote patient monitoring are expressly recognized and included in the definition of clinical practice improvement activities, which is one of the 4 performance categories physicians are required to report on in MIPS. And it also fulfills certain quality category measures as well. Another huge show of support for telemedicine happened this June when the American Medical Association approved a policy to include formalized training in telemedicine for all medical students and residents. The move means the organization wants to ensure that clinicians in training learn how to use telemedicine in clinical practice. And they're even encouraging accrediting bodies for medical education to include core competencies for telemedicine in all their programs. And lastly, financial support came from the HRSA when just last month they awarded $16 million to improve access to quality healthcare in rural communities, including funds that will specifically expand the use of telehealth. I think all 4 of these different examples really prove one thing, and it's that telemedicine is a significant and rapidly growing component of healthcare in the United States today. So what is it? Well, it's the delivery of clinical healthcare services from one site to another via electronic communications to improve a patient's clinical health status. And it includes a growing variety of applications and services using two-way video, smartphones, wireless tools, and other forms of telecommunications technology. Really, it's an attractive new care model, and the growth potential is great. So far, it's been easy to adopt, and patients are loving it. And it's being viewed as a cost-effective alternative to the more traditional face-to-face care. And it's proving to be an ideal format for improving patient engagement and creating a greater demand for services. So the elements of telemedicine. At the most basic level, the purpose of telemedicine is to provide clinical support by overcoming geographical barriers, connecting users who are not in the same physical location. And it accomplishes this by using various types of communication technology in order to improve health outcomes. This is what it's all about. At a very high level, these are the key elements that make up telemedicine. Now, if we get a little technical for a moment, it's important you can understand and identify the different modalities of telemedicine. And these are simply the different types of communication methods used between a provider and a patient to facilitate a telemedicine visit. And they include live video, which is live two-way interaction between a person and a provider using audio-visual technology. So I think this is the type we're most familiar with since it's similar to apps like Skype and FaceTime. Next is store and forward. And this is the transmission of recorded health history to a provider who then uses that information outside of a real-time or live interaction to diagnose. So as compared to a real-time visit, this service provides access to data after it's already been collected. For example, think of pre-recorded videos or images, such as if you send x-rays to your doctor, or maybe you take a photo of a skin rash on your arm and text it to your provider. Then we have remote patient monitoring, which is when personal health data collection from an individual in one location is then sent to a provider in a different location for use in care. This type of service really allows the provider to continue to track healthcare data for a patient once they're released to either home or to a different care facility. And then lastly is mobile health, which is healthcare supported by mobile communication devices, such as cell phones, tablets, or computers. And applications can range from tracking your daily heart rate, your exercise, or even your calorie intake. In the end, all of these methods are increasing in popularity and usage. So it's important to be able to identify which is right for you and your practice, as well as the patient population you serve. Now, as forces behind telehealth continue to build and grow, the obstacles in front of it are being removed. And healthcare organizations are recognizing some major benefits, such as improved access. telemedicine improves access to patients, but it also allows physicians and health facilities to expand their reach beyond their office walls. Cost efficiencies. Reducing or containing the cost of healthcare is one of the most important reasons for funding and adopting telemedicine technologies. Improves quality. Studies have consistently shown that the quality of healthcare services delivered via telemedicine are as good as those given in traditional in-person consultations. And patient demand. Using telemedicine technologies reduces travel time and related stresses for a patient, which increases demand for services. I mean, if we think about it, telemedicine helps small practices expand their care to those living in rural communities or housebound patients. It can also help reach the elderly. Maybe patients don't have access to a car, or those who just find it difficult to take time off work to go see a doctor. But not only are more populations being able to receive care, patients are able to talk in an atmosphere where they're most comfortable, their own home. So I think it's safe to say that when the limitations of location are removed, the patient experience greatly improves. However, with these benefits, as we're all aware, we'll see a fair number of challenges. And these can include inconsistent policies by states or barriers imposed by states, such as different services being covered, which types of providers can participate in telemedicine, and different technologies that are allowed. Also, a lack of standards. It needs to be established that the same standard of practice applies, whether the services are delivered in person or remotely. Licensure portability for out-of-state usage. This is a big one. The state licensure requirements should allow exemptions for telemedicine. Right now, each state has a different set of policies and practices, and only a few have reciprocity agreements allowing telemedicine to cross state lines. Some other states do offer a conditional license for telemedicine for out-of-state physicians, but not many. And lastly is commercial and Medicare and Medicaid coverage. Legislation needs to provide payment parity. And what this means is that it would require insurers to reimburse providers for services delivered remotely at the same rate they would pay if the visit were in person. Essentially, there's no single widely accepted standard for private payers. Some insurance companies value the benefits of telehealth and will reimburse a wide variety of services, while others have yet to develop a comprehensive reimbursement policy. So payment for telehealth may require prior approval. There really are different conditions for coverage for each insurer, public or private, which we'll start to look at next. So in order to better understand the current state of telemedicine in America, let's analyze these challenges by looking at a state telemedicine gap analysis conducted by the American Telemedicine Association this year. The two reports that we looked at were titled Physician Practice Standards and Licensure and Coverage and Reimbursement. And both of these reports aim to answer the following questions. 1, how does my state's telemedicine policies compare to others? Which states offer the best coverage for telemedicine provided services? And which states impose barriers to telemedicine access for patients and providers? Keeping those questions in the back of your mind, we can start by looking at this map, where each state was given a composite grade, with the majority of the country receiving a B, signaling what I think to be progress with the potential for growth. What this map begins to show us is that while there are some states with excellent telemedicine policies, lack of enforcement and general awareness have led to a lag in provider participation. So if we start by identifying reasons for this lag of participation, one very prominent barrier has to do with licensure and practice standards. Providers have seen a considerable amount of state policy activity to improve coverage and reimbursement of telemedicine. However, despite improvements to address the payment challenges, healthcare providers are encountering conflicting and restrictive policies surrounding telemedicine licensing and standards. Some states have adopted practice standards with higher specifications for telemedicine than they have for in-person care, such as requiring an initial or follow-up examination be conducted in person, requiring a telepresenter to be present during a visit, or even an additional patient-informed consent. Also, licensure portability, again, which is the ability for a healthcare provider to practice out of state using one license, is another large issue for healthcare providers wishing to provide these services. In the end, these added requirements and restrictions take away the convenience and ease telemedicine is meant to provide patients. So if we look at an in-person requirement by state, we can see how each state compares to one another. Those in blue have the most flexible requirements, whereas the two states in red have the most restrictive in-person requirements. Specifically, these boards have considered legal guidelines requiring an initial examination be conducted in person, and that the physician-patient relationship must be established in person. These laws effectively eliminate the possibility of most telemedicine models from operating in that state, and essentially take away the entire purpose of telemedicine to eliminate travel and the need for an in-person visit. Again, another challenge facing telemedicine is the restrictive licensing requirements created by each state for delivering services via telemedicine. Now, most states require that a physician is licensed in the state where their patient is located. However, these state-by-state approaches prevent people from receiving critical, often life-saving medical services that may be available just to their neighbors living right across the state line. You can see from the map, no state receives an A for licensure and out-of-state practice. There are a few states that have created some sort of pact. However, the majority of states are not involved in a reciprocity agreement and isolate themselves from interstate practice. Again, these types of restrictions are counterproductive and make it almost impossible to deliver quality, cost-effective care remotely. Switching gears a little bit, another huge barrier to telehealth is payment and coverage. Patients and healthcare providers may encounter a patchwork of arbitrary insurance requirements and disparate payment streams that don't allow them to fully take advantage of telemedicine. Not only that, but there's a lack of understanding about how each of the three major payer types, I'm referring to Medicare, Medicaid, and commercial payers, reimburse for telemedicine services, which has understandably prevented many providers from making informed decisions about adopting this technology. Right now, telehealth coverage laws are working to require health plans to cover services provided via telehealth to the same extent the plan already covers the same services if provided through an in-person visit. But at this point, coverage can really still vary by state and type of insurance, which we'll look at next. Starting with commercial coverage or private insurance, this sector really has been the most aggressive in reimbursing for telehealth visits. Many national plans embrace this healthcare innovation and have been steadily broadening coverage through partnerships with different telemedicine service companies. 30 states and the District of Columbia require that private insurers cover telehealth the same as they cover in-person services. And many other insurers cover at least some telehealth service, and many more have expressed interest in expanding their telehealth coverage. This is great news for providers, as it suggests that over time, telemedicine will gain parity footing with in-person consultations across the board. But beyond these laws, the high potential for cost savings in the commercial sector, which is an average of $126 per visit, has incentivized many plans to cover telemedicine. In the end, coverage really depends on the insurance carrier and an individual's plan, but we have seen a dramatic rise in private insurance participation in covering these services. New plans and benefits are being announced almost weekly to include this new technology, which shows a promising and exciting future for telehealth. Powerful players in the insurance market stand behind telemedicine and are dedicated to making it work as an integrated part of the healthcare system, not just for patients, but also for their providers. So if we look at Medicare and Medicaid coverage, these are the other two of the three major payer types in the healthcare industry today. What I want to point out here first is the big difference between them, which dictates telemedicine coverage. And that's that Medicaid coverage for telemedicine is controlled at a state level, while Medicare coverage for telemedicine is controlled on a national level. If we start with Medicare to get an idea of the type of coverage offered, for traditional fee-for-service beneficiaries living in rural areas, Medicare covers physician services using video conferencing where the patient is at a clinical site. Whereas many Medicare Advantage enrollees have much more flexibility and are currently covered for telemedicine services regardless of location. And then almost every state Medicaid plan specifically covers at least some telehealth services. However, Medicaid, again, differs from Medicare, and that policies vary from state to state. So each state has that flexibility to determine how it will reimburse for telehealth. Now, generally speaking, Medicare and Medicaid reimbursement is dictated by 5 key areas: the patient setting, or the originating site, provider type, type of technology, services provided, and distance or geography restrictions. So for example, the originating site, or this is the place where the patient is located at the time of the visit. A traditional approach to telemedicine coverage is to require that the patient be served from a specific type of health facility or a clinical site. And this is how it is for Medicare coverage. But left out by this approach are the sites where people are predominantly spending their time, such as homes, offices, schools, or just when they're traveling around. Now for Medicaid, again, it varies by state where the patient is allowed to be during a visit. But according to the ATA's report, 25 state Medicaid programs do recognize the home as an originating site. Eligible providers. Are you an approved Medicare provider type for telemedicine services? Or are you a qualified healthcare professional under your state Medicaid program? Most states in Medicare reimburse a reasonable amount of provider types, but there are some state policies that broaden or restrict the types of distance site providers. For example, Alaska, California, and Illinois are the only 3 states to cover services when provided by a podiatrist. Technologies used. Telemedicine includes the use of numerous technologies to exchange medical information from one site to another. Similar to the patient setting, no one policy dictates reimbursable technology across all state Medicaid programs. Sometimes technologies permitted for coverage may be restricted to a certain type. Now, Medicare is fairly specific, and they define reimbursable telemedicine as interactions that use real-time audio-video technology. Services. Medicare in most states cover an office visit or consultations, but some services are on the fence and vary by state. For example, ultrasounds and echocardiograms. They're the least covered telemedicine provided services. Again, it just depends on your state's program. And lastly, distance and geography restrictions. Distance restrictions are measured in miles and designate the amount of distance necessary between a provider and a patient as a condition of payment. And then geography can be classified as a rural area, urban, a defined population size, or a health professional shortage area. And there may be conditions in which telemedicine is only covered if you meet certain geography or distance criteria. Again, it's just another factor that can vary state by state and affect coverage. But don't worry, there have been some breakthroughs in Medicare coverage, and that have taken place recently. Effective January 1st, 2015, telehealth-based chronic care management was introduced as a new service covered by Medicare. In that same year, we also had the Medicare Telehealth Parity Act, and that proposed changes to Medicare telehealth payment methodologies and expanded coverage, not only to residents of rural areas, but urban areas as well. And it also included provisions for Medicare coverage of remote patient monitoring services for chronic care conditions and home dialysis for those with end-stage renal disease. So that's 2 of the restrictions of technology used and geography restrictions that were removed. And then most recently, the 2017 proposed Medicare physician fee schedule included expanded Medicare coverage for telehealth. And it did this by proposing increasing telehealth coverage by actually adding 8 new CPT codes for services beginning January 1st, 2017, in addition to the 80 that are already covered. Also, CMS is proposing to introduce a place of service code specifically for telehealth services. And this will help providers to clarify the confusion over whether to report the place of service where the provider is or where the patient is. Now, if we look at the other 2 major payers, which vary by state, these maps will give you an idea of where your state stands on coverage for both Medicaid and private insurance. Taking a brief look at this, I just want to point out states with the highest grades, or those in blue, provide statewide coverage and have no provider, technology, or patient setting restrictions, which I think is where the future of this digital platform is heading. So we've seen a lot of positive indicators for reimbursement across all three major payer types. And restrictions on reimbursement continue to be lifted in order to integrate telemedicine into our healthcare system. 2016 truly saw an acceleration of telemedicine services. However, 2017, I believe, will see exponential growth. So let's look at the future of healthcare delivery in action. So Cindy, I will go ahead and pass it off to you.
Lindsay, telemedicine is something I'm extremely passionate about and have been for a while. I've done webinars on this in the past in the early stages. It really does appear to be taking off. So what we're going to talk about today are the various deliveries of telemedicine and some success stories, and then we'll also kind of share a few things that are going on. So first, we're going to look at the CVS partnership that was introduced in 2015, and that's partnered with American Well, Teladoc, and Doctors on Demand. We'll talk a little bit about that service. And then you've got CVS and the Cleveland Clinic partnership that began in 2016, and that is distributed through American Well. I want you to think about American Well. This is not a company that we necessarily work with, but this is almost like some of the e-prescribing companies that popped up a year ago that came out with SureScripts and those things. So if we talk about who is American Well, American Well is a telemedicine technology solution that acts as a direct source of telemedicine services. It can bolt on, and you can actually logo with that, so that just as when SureScripts, even though you're using SureScripts to e-prescribe in most cases, it actually appears that you're doing the e-prescribing. That's kind of the concept of American Well, very similar to ZocDoc and some of the other online scheduling solutions. I kind of think of it like that. American Well also works as a delivery partner with hospitals and provider groups, so that's where you can get in and you can bolt your logos on and present them as a backbone to your services. We'll talk about other opportunities and other entities as we move through. So we're going to take a look at American Well. We'll take a look at the Amwell website. We're just going to talk to you about and take you through how it might work. So the first thing you can do is you go in, you log in. We went through this, and you can see the Get Started screen. And that's basically what you would click on, and then you would move to the next screen. And you'll be able to see, please provide some details about your visit, and we'll connect you with a qualified partner. We actually went through this. So who is this visit for? You can say myself. Where can the provider call you for follow-up if needed? You put in your phone number. Would you like to invite someone to join your visit? So if you added someone to the visit, what do you want to discuss today? You can punch in and simply check what you're doing. And then as we continue through that, you'll be able to go in and give your medical history. So it talks about any conditions you may have, allergies, medications that you're on, your vitals. You know your current vitals. If you have them, you can put in. Now, obviously, some of these, as you get into some of the wearable devices, you can actually share your vitals with them, or if they're working in conjunction with that. But in this particular case, it would be basically you would put your own vitals in. And you could also share a file or lab result or other information with providers. So if you're working with an entity and you have your records, you can actually upload the files in these programs. So as we move through that, what pharmacy are you using? You know, identify your pharmacy. And then once you put this in, it goes out, it searches, and it tells you who you'll be seeing. And you see, you will come up and says your provider today, so you will be seeing, we've blocked out the name, tells you their languages, their professional education, the years of experience, where is their residency and board certified in. And these are actually doctors that are working, or providers in some cases. It may not always be a physician. It could be a physician's assistant or something of that nature, that are working with American Well in their delivery mechanism. You acknowledge receipt of the privacy, notice of privacy physicians, and we'll move on. So that's actually how you get in and how it works, and that's powering the background. But we took it a little further, and we worked with one of our clients that we've done a lot of work with, and this is not necessarily in conjunction with NextGen. I don't want to imply that this is a NextGen. I know many of the people attending the webinar today are NextGen clients. We may have some that are not, but this is basically Reed Health is a group that we have worked with. They're based out of Indiana, and their background is also American Well, but this is coming as in, so we're going to take you through their story. First of all, they're located in Richmond, Indiana. They have been working with 2014. They've implemented the following telehealth initiatives: telecardiology, teleoncology, telepsychiatry, telepulmonology, endocrinology, and orthopedics. And then they have virtual visits using the app Reed Health Now. When you look into this, the website is powered by American Well and has a similar workflow to that of what we just showed you. Reed Health has also created an app available for download titled Reed Health Now for further personalization in their delivery. So they actually can take through, and you can use this app on your phone, and you can actually take these visits across your phone. So once you get into this and you start utilizing the app, the patient will find a provider who is on call, and these are Reed providers, and then they will be taken to their provider details where they can choose to wait in a virtual waiting room and then see the doctor for that visit on the same day. Now, one of the reasons when we talked to Reed as to why they did this is Reed is located, as we mentioned, in Richmond, Indiana, but they have a lot of providers in a lot of rural areas in Indiana. And some of the benefits as we get into this and some of the things that I have found passion, I've heard stories in Ohio from Cleveland Clinic and other areas that kind of follow the same suit, is that many times these patients are doing follow-up and they're looking at things, and it's just impossible for them to get to a provider in their local area, or perhaps they're working in farms, or their method of living is something that requires them to be labor, and they just can't leave and pick up and go to the doctor, and sometimes the physician is several hours away. And this is a really good way to stay in contact with your patients. So they can go into the virtual waiting room, and they can see a doctor the same day. And then what happens, it incorporates mHealth. So they've actually taken this in some of the things that we chatted about before, allowing a patient to sign up and sync their Apple Health information already on their iPhone to their account. So if you're using your iPhone, and I don't know how many on the call have an iPhone or a Fitbit or anything, in this particular case they're incorporating the iPhone and iWatch, but Fitbit has a lot of things. A lot of these have things. So you can look at these and you can sync your health information. So you see the screen for the health access, and you can track your calories, your biotin, your blood glucose, body fat percentage. All of these things have them. I have an iWatch, and I will tell you, I have personally become very cognizant of when I stand, when I sit, when I move about. I don't take it to this level, and certainly haven't used it, but I think this is really a methodology in how patients are moving forward and being able to communicate with their physicians and their medical facilities. So as we move forward from this, what you basically are moving into is now mHealth, which is also known as mobile health. And it's a form of telemedicine using wireless devices and cell phone technologies. So you could utilize things such as wearable technology, like we mentioned, gadgets that companies such as Nike, Fitbit, Jawbone, and Apple have all produced and brought to the market. And these incorporate with mobile apps that can actually download and sync, because my iPhone alone and my iPad and my iWatch alone don't have that information. There are other apps that actually bring these two devices together. Although I will say that on the iWatch and the iPhone, their health app is pretty sophisticated. There's a few things that it won't do, but pulse rates and those type of things, it's really pretty accurate and has worked very well from this testing that we've done. So these mobile apps are software programs that run on smartphones and devices, and as you see from some of the screenshots we've got, the Apple Watch is both a wearable technology and a mobile app. So it has both of these. So it can improve chronic condition management through monitoring of vital signs, etc., and all of these are part of the standard iHealth using the iWatch. And here's the Apple Watch from a provider perspective. So if we're continuing to look at the example we're having in the success story that Reed has had, you will see that in this particular case, this provider that we have up, and we're looking at the patient, you'll see the vitals, the test results, the things that have been brought up and uploaded from the iWatch to the iPhone to, in this particular case, the system, which is being shown on an iPad. Now, all of these devices are Apple. We're not here promoting Apple individually. They just have done some things that have been kind of leading technology, and this happens to be the vehicle that this particular group has chosen. As I mentioned, Fitbit, Jawbone, Nike, everyone's coming out with this. This is really one of the areas that I would say is the fastest growing method for involving patients and getting patients engaged in their own health care and being able to communicate with their providers in their healthcare facilities. So that's telemedicine today, and that's with Reed. We talked a little bit about that. We talked a little bit about CVS, and these are just examples of having done it. When we looked at options, and I've heard success stories, some of the things that we've heard is Cleveland Clinic is doing some very good things, and they set up some telehealth opportunities where that they will actually go into a gym in a particular rural area, and they will have a nurse or a physician assistant who will be there, and they will actually set up recurring visits or follow-up visits to their cardiology patients that maybe go to the main facility in Cleveland, but again, going back to those rural areas where it's a 2-hour follow-up, they're getting much more success rate by even utilizing telemedicine in that capacity, where that you're able to do it and you have it in as Lindsay had mentioned earlier, you have a particular area that you go in. It may not be operating from your home. It may not be doing the telemedicine like we talked about in these examples, but it's something that the entity has set up themselves, and they deliver a methodology where that people can come to a particular location in a rural area and have the physician working remotely where someone else is there taking the vitals and moving up. And in many cases, if you start researching this, you can see how things have, people's lives have really been changed, and your follow-up activity and development of, and improvement of chronic conditions has also been improved. So it's something that I think everyone recognizes is the wave of the future, and it's a way to deliver that triple aim where that we are improving the quality, we're improving patient engagement, and we are reducing costs. And all of it is using this technology that we've striven so hard to put in place over these years. I mean, I know that everybody struggled with this. We've all worked together to bring here, and now we're being able to see some of the positive benefits, outside of meaningful use and outside of MACRA and outside of all of the things that are happening. We're actually being able to see some of the positive benefits of the automation that we've been working so hard to deliver. So that's telemedicine today. Let's talk about telemedicine tomorrow. So according to a new market research report, the global market for telemedicine is expected to be worth more than $34 billion by the end of 2020. As we all know on this call, we've got a shortage of physicians. We have to be able to deliver more effective health care in a faster, easier, and frankly more convenient way. We also have a population that is increasing with the millennials, that they have an expectation of being able to do things using their devices. That's what we have been driving towards. That's what we have now, and whether we like it or don't, I personally think this is one positive area of this technology. However, that is the market, and that's where we're going. So think about that, $34 billion by the end of 2020. It's not that far away. I thought yesterday was just January, and we're already back at Christmas. So, and the holiday season. So, think about how fast time is traveling. Approximately 71% of employers say they will offer telemedicine consults through the health plans by 2017. That's back to that savings. As healthcare costs increase, insurance costs increase. This is a way to be able to deliver that and get patients more involved in their own healthcare. We're driving growth in this market. Researchers say as an increasing age population, increasing incidence of chronic disease, and a rapid rise in the software market. You can see that with the changes that Medicare is already making by being able to do the chronic visits that you can do remotely over the phone and being able to work with your providers in that capacity. Still not easy to get paid on that, but they are making an effort to move towards that. Then as insurance companies see documented efficiencies, they too are increasing coverage of these services. So while you saw by the maps that things are getting better and it's still very state by state and there's still a lot of different methodologies, you can see that insurance companies are slowly jumping on this bandwagon. I've even heard of some carriers paying for Skype visits, and I'll talk a little bit about that as we get to telemedicine tomorrow. And you're using Skype and some of the other very basic programs that you have available to you today. So lastly, telemedicine is changing the way medical care is delivered. Patients are embracing it. The cost savings are increasing, and its efficiency has been proven. However, doctors and providers are still somewhat reluctant. And as we look into why that may be, and moving forward, there really are a lot of reasons that, how can I see my patient? How can I get that personal touch? By being able to pull this information up, and that's where I'm going to move into Skype. A few years ago, we had a provider who really had some patients that were out of state and wanted to use Skype. Now, they had, we talked to them, we worked with them on it. They wanted to be able to just document in their current system, but they wanted to be able to physically see the patient. At that time, there was no BA agreement between Microsoft and anyone. That has since changed with Skype. However, other entities that are out there may be more beneficial. You need to make sure about your security. You need to make sure that it is, it is HIPAA-based. All of the things that we've heard are fears, and why there's been reluctance has really been about the personalization of care. Am I going to miss something? What are my liabilities? How can I avoid this? And then, am I meeting all of the requirements of HIPAA? And those are the type of things that you always need to consider if you're looking for this, and make sure that you have a vehicle that you're using, whether it's one of the ones we've mentioned or other ones out there, that will give you what you need with the security you need. So let's talk about the keys to a successful integration of telehealth. So you've got it. We talked a little bit about Reed. Mentioned the Cleveland Clinic. We mentioned CVS. And then again, those smaller providers that are just using a Skype. Let's talk about the keys to a successful integration of telehealth. So key tactics for developing a successful telehealth program is you need to build an effective team to provide oversight. Even if it's a small, moderate implementation, you have to have someone to make sure that all those things I just mentioned are in place. You want to identify an executive champion and a physician champion, and you want to make sure that you understand why you're doing this and what the benefits for this are. So you want to, first of all, as I said, understand why. So you want to assess the needs and demographics of your community. Is there a place for it? Will it be covered? Is there a need? And then once you determine and you decide you want to move forward, then you want to design your telehealth program with provider input and expertise. Make sure that when you're doing these telehealth visits and the things that you're doing, that you have covered everything you need. You want to develop an integrated marketing plan. It's only going to be as good as your patients know about it. If they're not participating, you haven't been successful in rolling it out. Identify the metrics to measure the outcomes. Is it successful? Is it worth the effort and the time and the money that you're putting into it? And are you increasing savings and increasing your patient base? And is it really contributing to your patient health? You finally want to design a multi-phase implementation strategy and then build on your existing brand reputation and quality. If it's your practice, let your patients know that it's really something that you're enhancing and you're trying to bring this to them as an added benefit. And finally, align your telehealth program with your organization's values and other ongoing initiatives. This is really one of the drivers for population health, and as you move outwards into population health, and we've done previous webinars on that, this is a key integral part to population health. If you're going to do that outreach, make it easy for your patients to reach back in. Gaining patient buy-in is also going to be critical. We mentioned that you need your marketing plan. Why would a patient want to do this? I can tell you why I would want to do it if it's something simple, and I can certainly tell you why my mother, who has had, as our population ages, my mother in particular has utilized some of these benefits when it's just a quick follow-up or something to do where that it's not as easy for her to get out and go to the provider, go see the physician, particularly when the cold weather is coming and it's harder. So explain to them it's increased comfort and convenience. It's an decrease in cost. Everybody cares about that as our premiums are going up. And it's a comparable quality of care. You're seeing the provider, they're getting the information. In many cases, they're getting as complete and accurate information as they've had before. And finally, and most importantly in my mind, it's continuity of care. The example I gave of the Cleveland Clinic and the cardiology patients that are getting their follow-up that way, that is ensuring that the continuity of care stays the same. That they're not just coming for those large visits, or they're not missing visits because they just couldn't get away that day, or they couldn't take 4 hours round trip out of what they were doing on their farms or in their particular stores or areas where that they can't leave. This is a way that they can do that quickly, efficiently, and easily and get the well-needed care that they need. Provider buy-in can be something different. We talked about some of the things that you do in setting up your providers and making sure that they understand and overcoming those objections. But we need to make sure that they recognize telehealth buy-in starts from the top down. Encourage active participation in the providers. Get their guidance. Let them understand that they are part of this and that they may at any time tell the patient that they need to see them in person, or they can be completely digital. They don't have to do both, and it's always getting their buy-in. Arrange for education on how to provide quality care. There's a lot of different things. Let's talk about website manner instead of bedside manner. Let them know that they actually can do this and still give the care that they really want to give to their patients. And then provide reassurance. Combat and mitigate the provider pushback. Let's overcome those fears that they have, because many of them do have fears. And understand that they may be uneasy or feel threatened by the fear of a decreased patient volume. That's not what this is for. It's a different kind of patient volume. And if it's done properly, you can actually increase your patient volume, because you're going to be getting those patients that are looking for and expecting this type of treatment and this type of service. We mentioned website manner. Telemedicine's rapid growth means more physicians will need to be trained on how to handle virtual visits and develop a good website manner. We had those challenges when we went to EHR initially. They didn't want to do it. They didn't want to be looking at their patients away. Now they'll be seeing it, but they also want to make sure that they understand how, that they can use the technology and understand that the patients will receive the same they would if they were in person. Physicians should be aware of their internet connection, their camera resolution, audio equipment. All those things have to be in place. It's not necessarily something that you can do without any type of effort or foresight, but it shouldn't be something that has to break your bank either. There's a middle ground for it. But you want to make sure that all of those things are in place and that they have sufficient bandwidth and things to make sure that they are being able to do it and that they all of a sudden won't die. We've all been on those sessions where all of a sudden our computer drops, and that's not going to be very comforting to a patient. So you really want to test that out and make sure that that's not going to happen. You also want to make sure that wherever you're conducting this, the lighting and background are key elements of getting the website manner right. Make sure the patient can see you. You don't really want to be in a position where it's, as I said, choppy audio, they're not looking at the camera. So it's going to take some practice, and that's a website manner just like a bedside manner. This will be deployed if you decide to move forward. It's also going to be a multi-phase implementation. If you want to ensure success, you don't do it all at once. So do your foundational research and get your organizational buy-in. Then have an employee launch. Pilot programs acting as discovery process to gain feedback, make changes, or provide additional educational resources. You let your employees work through this, and then employees can become word-of-mouth ambassadors for the program. Let them maybe see the physicians. Let them try this, and then you go through your public launch, and then you have your ongoing promotion and engagement. The key components of an implementation of a program of this type is awareness. It's introducing a new way of healthcare delivery to patients. So you can send out emails, newsletters, text messages. Make sure that when you're seeing your patients in the exam room or your physicians are seeing the patients in the exam rooms that they are letting them know, much like you did about the portal. Think of it as a new and adventurous stage of portal. Then engagement. Grab the consumer's attention in their own environment. Maybe screensavers, web banners, social media marketing. There's all kinds of ways that you can do this. Again, think portal. Each of you had to go through this, getting your patients to engage and activate the portal. Maybe that's still a work in progress. This is not something that will be unlike that. It's about letting people aware that you're moving in this direction. And then your utilization, encourage use and stay relevant. Keep sending information out, doing updates, expanding the services. If you just start it and it becomes stagnant, just like anything else, Apple comes out with a new iPhone, people line up to get it. Those are the same type of things that you want to do. Keep it moving, keep it updated, and keep it current, and let the patients know that there's always something new that they will be able to utilize. So in the end, we've talked a lot about things. As I said, I'm extremely passionate about this. It's something that I think, ITENIV thinks, I know Lindsay and I have talked, we're going to be presenting at MGMA. In the end, I think every practice is going to have a different telehealth transformation, and there's no one size that fits all or one right way to accomplish it. Every practice or organization is unique. The one thing I do know is every practice needs to think about it, because it is coming, and it is something that is being pushed. And I think with population health expansion, there's just so much potential to extend and enhance the quality of care to your community of patients while supporting the growth of your own healthcare organization. It just can't be overlooked anymore. It's part of it. And as we move more to value-based healthcare, this is an area that I think is going to become more and more popular and, frankly, relevant with everything that we're doing. And then as with all changes that have been thrust on us, you need to find your own way. And you need to do it in a way that's consistent with your values and with your internal resources and with your providers. Make sure that you look at how you're doing this, what's the best way to deploy it, and take it as it comes. Because in the end, it's your practice, and you need to make sure that it always is delivering the quality of care that you want. And finally, I'll ask everybody on the question, what will your next doctor's visit look like? I personally think that this is a really positive area, but as you walk away from this, just think about it. What will your next doctor's visit look like next year, 5 years, and 10 years from now? So as we close to this, uncertain where your practice stands, let's let ITENIV help. We can do things by assessing your current readiness, providing recommendation, and implementation of new processes and procedures. If you're looking for next steps, you can visit us at iteniv.com. You can sign up for our webinars and blogs. Many of you are already on our webinars, but we also have our blog. And then you can also consider our 3-day fixed price on-site consultations, looking at clinical workflow, revenue cycle, front office, technology, and performance. And then we also have several products. You can get online and test drive those products. We can make arrangements for you to do that for Refund Manager and ChartGuard, which is online business continuity. And now I'll open it up for any questions.
Hey, thanks, Cindy. Thank you so much. And Lindsay, thank you for that as well. That was a whole lot of information that we just threw at everyone. So please feel free to ask any questions. We'll take them in the order that we received them in. And if you have any questions that you think of once we get through them, you also see Lindsay's and Cindy's information up on the screen. You can always reach out to either one of them, or you can reply back to the email that I'll be sending out next week with copies of the slides and recording as well. Basically, any way you can think to ask us a question, just ask it, and we'll be happy to answer it. Okay, so first question. And you touched on this a bit after they asked it, but I think it's still worth asking. So what HIPAA-compliant video technologies have you found that practices can purchase and use to conduct their own telemedicine visits for follow-up care after surgeries? We aren't interested in using other physicians for the visits.
Well, I'll grab that one, and then Lindsay, if you can jump in. The one in question that we received the most questions about has been Skype. And Skype initially was not HIPAA compliant. I mean, it's not so much the technology in terms of how you're doing it. It's really about how the visit is being conducted, and if you can get a VA agreement. You can, depending on your size, Skype now through Microsoft does have a VA agreement. That's the smallest one we found. American Well doesn't have to use other physicians. It can actually be your own physicians. You can just use it as a background power, much like I said, like SureScript, or if any of you are familiar with ZocDoc or any of the other online scheduling programs. We're looking at a couple of other. This is really somewhat new technology. Lindsay, I think you looked at several. Did you find any other that we were able to validate outside of Skype and American Well, and then the ones in the beginning of the slide?
Just looking at it, I mean, a lot of the telemedicine service providers out there, obviously they're all very big on being HIPAA compliant, and definitely as well as the security issues that come up a lot with this topic. Like you mentioned before, Cindy, I think it's important that I understand whoever asked this was worried about using other physicians. That's the best part about these, is that you can use that provider's physicians, or you can just limit it to your own as well, which we found, which I thought was pretty cool. According to other, I would say other products, like if we looked at Skype or Microsoft, that's all I've really heard of. Apple has been notorious for not having VA agreements, but there has been rumors out there that they're actually expanding their EHR capabilities and giving out VA agreements along with those lines. So we'll just see what the future holds for that. But just looking at specific telemedicine service partners, they are all HIPAA compliant. They are all concerned with the security issues, and they do offer the ability to use their providers or just your own as well, with your own label or your own organization's recognition on that front page.
It's going to vary by your size as to which direction you want to go. Obviously, you get into American Well and you start thinking about CVS, but they do have scalable solutions. Teledoc, Doctor on Demand, there's a number of different solutions, and we are, as I said, researching a number of different things. We may even have some discussions that we can make at UGM if any of you are going to be at UGM. I'm not prepared with one that we're looking at, but it's because I don't want to give bad information, but we're in the researching. So if we're at UGM, track us down, because I'm hoping to have some things available by then as well, just some ideas.
Okay, thank you both. Next question. With how expensive technology is these days, how does telehealth make services more cost efficient? Lindsay, do you maybe want to answer that?
Yeah, that's fine. A lot of this with cost efficiency, I think the best way to answer this is to kind of give a few examples here. So with telehealth patient monitoring programs, if we're thinking about it, it's helping keeping patients with chronic diseases healthy. So they're actually avoiding unnecessary medical costs, such as hospitalizations and nursing home care. I mentioned in the private insurance industry right now, plans can actually save up to $126 per visit on average. If we think about telehealth specialty programs that are based in hospitals, these can connect community hospitals with major medical centers. So that's lowering the cost of treatment by staying at a local facility. So you're actually cutting down on transfer services, patient transportation, and provider travel as well. So those are just some some of the examples on how these costs are really cut with this technology. Basically, by bringing the care to the patient when they need it, you're preventing a more serious condition from occurring, which would in turn increase health costs depending on the illness and more intense care required.
Okay, thanks, Lindsay. And it looks like this might be our last question, so we'll ask it, but we'll hang around for another minute or two just in case people are in the middle of typing ones as well. Is there any facility or physicians group in Southern California already performing and getting paid for telehealth?
I don't know specifically about Southern California. Do you, Lindsay? I mean, in my research, I didn't find anything specifically.
I was just going to say, I'm sure there is. It really just depends, again, on the state coverage and who you're looking to be paid by for Medicare, Medicaid, or private insurance. I'm not sure of any specifics, but
and we've encountered New York. When we were doing the research, we've encountered New York, obviously Indiana, which is the one we referenced, Ohio. That's the ones where we've actually worked specifically with individuals. I'm trying to think. I think one of our groups in Arizona is doing it as well, so I'm sure Arizona has some capabilities. I don't know, again, specifically about California. We could look at the states, and I don't mind. We'll do a quick research on it.
Right. I think the opportunity is definitely there in California, and I would be very surprised if no practice is. I think that's happening there. It's just, again, I'm not sure on the specifics of a practice.
Okay, well, thank you for that, ladies. Again, that's all the questions we have right now, but we'll hang around in case anybody has any more. Thank you so much for joining us today. I really hope that you found this informative. Cindy, Lindsay, thank you both for your research and presentation on this material. And we're going to be at UGM as well as MGMA, so please stop by and see us if you're going to be at either event. We'd love to meet you there, and you can always connect with us on social media as well. So thank you, everybody, for your attention today, and I hope you have a great rest of your week.
Yes, thank you very much.
Thank you.
Bye.